Hello, Lancer Nation. It's been a while since our last episode, and as they say, the more things change, the more they stay the same. With COVID in a continual state of flux, the numbers will remain up for interpretation as we consider outbreaks involving migrant workers and long-term care facilities. So depending on how you massage the numbers, your interpretations may vary. That said, in my mind, we're at a critical time in this pandemic, particularly as we move from one phase to the next, gradually opening up patios, barbershops, and so forth. My concern is that complacency could lead to what we're seeing across the border, that being a steep rise in the number of cases. It's all over the news. Just watch CNN. And also keep in mind that we're still in the first wave. A second wave is inevitable as we inch closer to another flu season, just to complicate things a little bit more. So far, more Americans have died from the COVID compared to those that died in the First World War. The numbers are escalating and it's staggering, to say the least, with the United States accounting for at least or approximately 25% of the cases and deaths worldwide. To me, this is a very sad commentary, and so watching this unfold should get our attention. It is mine for sure. Simply put, we need to be better than that. We need to be much better than that. The blueprint, as we mentioned before, remains unchanged, and the recipe remains very simple. Stay home when possible, wash your hands and wear a mask when you go out or when you cannot socially distance. And why the mask, I ask? Because I'm hearing all kinds of misconceptions regarding the usage of masks. So here's the deal, and once again, if you've missed the mask message, wear them, protect those around you, and hopefully they will do the same to protect you in return. It's that simple, so care enough about your fellow person and mask up. Also, as we know, there is no cure or vaccine for COVID, nor will we likely see anything in the foreseeable future. So more importance will be put on getting your flu shot this fall. And why is that? Well, the rationale for getting the flu shot is pretty simple. Number one, it helps protect you from getting influenza itself. That's an illness which itself carries a significant degree of morbidity and potentially mortality. It's not just diarrhea and vomiting. That's number one. Number two, influenza and COVID share very similar symptoms and are likely to onset around the same time, likely late fall. If we can mitigate the influenza outbreak, this will negate the double whammy effect on the COVID pandemic. The result is less stress and strain on an already overburdened hospital system, especially our emergency departments, ICU departments that feel the brunt of things. So please, if you've gotten a flu shot in the past, continue to do so. If you do not get one, for whatever reason, please rethink your stance on that. The number one most important thing that we do in medicine, and I think most physicians would agree about this, is vaccinate patients. It's very safe, there's very little downside, and has a very huge upside. A couple more issues. One more public health plug. Student health has and remains open for essential services with limited hours. We are now providing optional virtual medicine via a Teams type format, which is proving very helpful for students. Our hours are likely to expand to accommodate student needs and to include things like vaccinations. We're figuring this out at this time because we're seeing some anxious faces out there that want to complete or start a series for things like hepatitis, HPV, meningococcal meningitis, or just for boosters. Ultimately, we plan to revamp our website with educational information regarding these preventable illnesses. So please stay tuned for further details and try to frequently check our website. Stay well and stay safe. Bye for now.